Thank you, Maluba, and thank you, Elder Valerie, for that amazing opening. And thank you to all of you for joining us today. We're really looking forward to this, our last session. In efforts to bring diverse community voices to the table and meaningfully involve people living with HIV, and to inform our meeting agenda and objectives, our team hired 6 highly qualified community members from across Canada and trained them to recruit and facilitate discussions with community members from across the country. Specifically, we've hosted 5 discussions with key populations of people living with HIV who are not already represented in our meeting agenda. The community consultations focused on the topic of wellness, and we discussed what does wellness and living well mean in the context of living with HIV in Canada. 2 group summaries and the demographic data were presented by Makiki and Sylvain on Monday. Those were from the People with Experiences in Drug Use and or Sex Work group and the Francophone Community group. 2 more community consultations were presented yesterday, the Youth Group Summary by Asha and the Middle Eastern, South Asian, Southeast Asian, and East Asian Men's Group Summary by Kenneth. Today, Jackie will be presenting the summary of the Women's Group, and Chantal will present a summary of all the recommendations to clinicians, researchers, and policymakers that emerged from all of the community consultations together. So first, we will have Jackie present a summary of the Women's Group. Welcome, Jackie.
Hi, good morning. My name is Jacqueline Flett. I'm from Winnipeg. I'd like to do a land acknowledgement of the Treaty Territory 1 and home of the Métis Nation that I reside in Anishinaabe, Dene, and Ojibwe and Ojibwe. So with the women's group to begin with, I just want to talk a little bit about sage. Sage is used to prepare for ceremonies and teachings. It releases what's troubling from the mind and removes negative energy. It's there to use to cleanse homes and sacred items, but it also is a woman's medicine. And that's why I presented this today, because I'm representing women of the demographic that I did. I'm also wearing a shawl gifted to me from Elder Leslie Spillett, and she's another woman that I'm very, very attached to, and she's been a really good knowledge keeper. So that's somebody that I see dear, and I keep well in my heart. So I'm Jacqueline Flood. I'm the community consultant for Living Your Best Life and Living versus well with HIV in Canada. So I did the women's group. So some of the things that we learned, that wellness is more modern versus being being well-being. Wellness, health, and equals happy and healthy. Both require self-care and they're interchangeable. Definitions are interchangeable. Wellness basically equals health. Well-being is more holistic. Overall health in non-medical and encompasses social determination. Example, you check on someone's health and well-being as opposed to somebody's wellness. And so you need to flourish to nourish. You need a lot of self-care. So the next question was, we asked about their wellness journey, and so some of the things that I learned in the wellness journey was to use a feather about the speakers. So wellness is a journey. I feel like I am surviving. I contact friends and doctors when I feel unwell. Taking care of my adult daughter and mother gave me purpose, not alone. Family is very important to my wellness. These are some of the spoken words right from the women, and to honor them, that's why I'm holding an eagle feather, because it represents truth and you can't lie when you hold the eagle feather. So some of them, my HIV has been under control since my diagnosis 8 years ago. I do what the doctors tell me to do. HIV is easier than everyday life. Living with HIV for 18 years, I took upon tennis, yoga, read books on how to be happy, and the best actions to release my wellness was at the time of my diagnosis. Survival is thriving. It was very important to me. 10 years positive with HIV. It was time to significantly increase my knowledge and realization. I was able to create the life I wanted. 25 years with HIV I was very sick and was diagnosed late. I needed peer support at the beginning to get through, help manage me being not so sick. I took supplements in addition to HIV meds. An acceptance of HIV is important. Living with HIV for 23 years, try to stay positive, need confidence, and through the hard days, no other days will be better. Try to work out more with COVID-19 and increase. So for the next one, it was recommendations was capacity building, housing and shelters, more mental health services, racism in the healthcare needs to be addressed. And they should have BIPOC interactions in HIV, lipodystrophy from early HIV art is hard to live with. Take back your power, have a national HIV men, and encourage less struggles. HIV and aging needs to be set as a priority. More holistic options and service burnout was post-traumatic triggering events. In the end, some of the barriers were, relationships, finance, toxic people, and also unemployment. And what recommendations do you have for the researcher? Is they felt they were still being stigmatized, and they need more voices of positive peer support groups, and that money wasn't an issue at all. And that's the research themes. Except for no cost, no one complained about their current regimes. Lots of HIV stigma will still exist, toxic relation, immigrants require more support, burnout, and overall group was very supportive of each other. Thank you very much for my presentation.
Thank you, Jackie. Thank you so much for all the work in facilitating these groups and pulling together these recommendations. Really appreciate it. Now we'll move on, and Chantal will be presenting to us on the summary recommendations from our 5 community consultations on wellness and living well with HIV in Canada. Chantal va maintenant nous présenter une sommaire de ces recommandations des 5 consultations communautaires du bien-être pour les personnes vivant avec le VIH au Canada. Bienvenue, Chantal.
Thank you very much. Merci beaucoup. Bon après-midi. Good afternoon, everybody. I will start for the land acknowledgement. Toronto is a traditional territory of many nationals, includes the Mississauga of the Credit, the Anishinaabe, the Chippewa, the Hanissadoni, and the Wendat people. Toronto is now home to many diverse First Nationals, Inuit, and Métis people. I would like to introduce the team and the project description. We had 5 consultations with HIV community member participants from 5 key populations. Go up. And I will summarize the recommendation the participant made for clinician research and policymaker. We have a men group, women group, experiencing substance use people, sex worker group, youth group, and the Francophone group. Next. This men group is come from Middle Eastern Southeastern and East Asian. First, universal health care and pharmacare. Increase access to social services and reduce stigma when trying to access these services. Too hard to access these services, too little compassions. Discriminalize HIV. More research on what does aging with HIV means. Increase public education related to HIV as the way to decrease stigma. More opportunity for HIV advocacy and the peer navigator work, preferably paid training and paid position in ESOL or research project. Next. Women group recommendation. Increase health services coverage and availability, accessibility. Lipodystrophy removal not covered is impact both mental health and emotional wellness. HIV sensitive mental health or social worker services is not available in certain area, and that is too much stigma. Culturally sensitive, culturally appropriate services, and more research on what does aging with HIV means. Increase access to and funding for community-based services. Increase access to and funding for wellness activities targeted to women living with HIV. Wellness services like massage, dental counseling, free subsidized gym access. Next. Substance use people with experience and the sex worker group recommendation. First, translate knowledge from research project into policy. Don't read all the same research question. Action on the recommendation. The government should give money to the right organization so services, recommendation can be implemented. Stigma needed to be addressed. More education to public, healthcare worker, stigma against HIV, substance use, and sex worker. Sex worker has increased during COVID isolation. Need a way to address loneliness and prevent avoidable death. HIV medication, Regima, need a more tailored approach. Up-to-date substance use policy. Increase women central policy, research, and project. Next. Youth group recommendation. More education targeted to general public, healthcare worker, and the teacher. We help to reduce HIV, STBI, stigma, and prevent transmission. And the teacher needs the resources to provide proper access and the HIV education, especially U equal U and the PrEP. More financially and emotional support for youth living with HIV, because many youth face housing and the food insecurity. HIV manifests these problems. Safe space for medication use, substance use, peer support needed, universal pharmacare. HIV medication are not covered for everyone, and many provinces require a copy. HIV is not our only problem, or ever our many problems. Quality of life and the wellness is much better. Next. Recommandation des francophones, le groupe de discussion. Travailler sur l'éducation de I égale à I en français. Nous avons besoin de possibilités de recherche sur le VIH en français. Nous avons besoin de meilleur accès aux services de santé spécifiques au VIH en français partout au Canada. Les médecins spécialistes du VIH doivent changer le moyen de travailler, pas juste parler du CD4 et de la charge virale. Nous avons besoin d'outils pour lutter contre la stigmatisation, la discriminalisation et le racisme dans le secteur du VIH. Élimination de la stigmatisation liée à la santé mentale. Les politiques pour la lutte contre la stigmatisation et les immigrants séropositifs. Accès aux traitements injectables.
Concerning the HIV positive immigrants, we need access to injectable treatments. We need a vaccine against HIV, an HIV vaccine, and financing for HIV positive Francophone women in small businesses in Ontario, Quebec, and throughout Canada, and more information on the COVID-19 vaccine and its availability for HIV positive people.
Clinicians and the health care provider offer HIV and the related health services in a stigma-free, culturally sensitive environment with increased availability of French language services. Wellness is not just a good seed for account or suppressed viral load. Is to take whole well-being of the person. Research what it means to live and age with HIV and be on HIV medication. Compassionate HIV community member for involved in a project. Include key population in conversation. For example, Francophone, women, youth, and the people aging with HIV, new immigrants, people, substance use people, current sex worker, indigenous people, ethnic minorities, policymaker, universal pharmacare to cover HIV and other medication, money for education, general public, healthcare workers, and the teacher need to be better informed about HIV to prevent, to be informed about HIV as the way to decrease stigma and prevent future transmission. Applying for housing support and the disability compensation for people living with HIV need to be easier and less stigmatizing. More money to HIV health or community services organization so peer can be trained and pay their work. A living wage. Peer support is a veto for wellness. JIPA and the MIPA principle should be followed. Thank you very much. Merci beaucoup. Obrigada. Asante sana. Murakoze cyane.
Thank you, Chantal, very much. Bon travail.
Merci.
And thank you to all of our community consultants. You did a wonderful job leading these consultations and presenting back to us during these 4 sessions. We really appreciate it. This was born out of necessity from the COVID pandemic and not being able to do our consultations in person. But I actually think it was one of the few good things that came out of COVID, that we really had a really rich consultation with community through all of your efforts. We really appreciate that. And also thank you to all of the community members who joined in the consultations on wellness. your voices were heard and were really appreciated too. So next, I'm going to pass it over to Tammy to